Hi, welcome back to Future Fast. And once again, we have Kumar Sankaran with us. And for those of you who are here for the first time, you have missed two very interesting parts of the podcast that we've had with Kumar. So I really urge you, please go back, listen to the first part where he shares his journey so that you'll be able to connect where the thinking comes from. And second part is what kind of work they're doing. And it's very interesting. We covered a whole lot of things about what's happening in the business, what are the challenges, and even how the price points and what kind of collaborative opportunities are there, what kind of compliance don't exist are trying to fit in. So it's very interesting. So please do catch up. And with this, if you're not yet subscribed to Future First, do that now. And Kumar, once again, thank you so much for making time to be here with us.
Thank you again for inviting me. This is was it's a real honor to be here again.
Pleasure, Kumar. So, see, in your journey, as you see, before I ask you the question of what is your take on the future, what are the things that are currently happening for some time which you think will not change in the future?
um, us taking care of our health, I guess. Uh, we I think we're still going to wait for a symptom to show up before we actually go and do something about it. I hope that's the thing that changes, but 'cause that's what's been constant over all these years and centuries, where we're not proactive enough about health.
Right. So, well, with that, what's your take on future? Where do you think we are headed from in the line of business you're in? Where do you think things are going to change? And
Um, yeah, I mean, it's the microbiome is such a key new facet in the healthcare space. I mean, because we're in the healthcare space, I'll talk about healthcare, but I mean, this could be agriculture, this could be just general environment. The microbiome is playing such a huge role in that, and the knowledge, acknowledgement, all of that is increasing every day in the space. The future of healthcare is going to be so different in the next 10 years' time. Um, um, Again, there are so many aspects that we can talk about, from wearables to telemedicine to to how the insurance could shape healthcare in the future. But I'll stick to the microbiome. Just it's going to fundamentally change the way pharma does discovery on therapeutics, and the kind of new products that are going to be coming out. The new therapeutics would not target the human cells or receptors on the cells. The new therapeutics would be targeting the microbes in your body. So everything would so it'll either enhance a microbial activity, or it'll bring down a microbial activity. So that is the shift that is happening. And secondly, with again, with the microbiome and with a little bit of genetics, we'll see a lot more truly personalized medicine that is going to come about. Um, so so I think the future is going to be very different. I don't think I'll be able to, um, especially from an R&D pharma R&D point of view, we won't be able to recognize it after in the next 5-10 years time.
well, Kumar, sorry, I see some bit of contradiction. See, the first thing you said about how uh, 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 the healthcare will evolve is very highly pharma industry driven, right? And second thing is personalization. But at an industrial scale, do you see personalization happening? Don't you think it's a bit of a contradiction there?
Yeah, no, I think personalization will happen over there. I think there have been a few technical challenges in terms of production and in terms of um, in terms of even what is truly personalization kind of questions. But I see a lot of places where gradual changes are being made. I'll give you an example about probiotics. I mean, a segment that we work very heavily on. Till date, the only probiotics you can have is what you can get prescribed or off the shelf. I mean, there's nothing truly personalized about that. We will soon be launching personalized probiotics. I mean, we've managed to figure out the manufacturing difficulties and put together personalization over there. It'll be truly personalized based on your data. There's a company in US which has already done this quite successfully and been in the market for almost a year now, doing it very successfully a year. And the farmers recognizing it. I mean, the conversations that I've been having with the big farmers like GSK, Pfizer, J&J, Johnson Johnson, and all these farmers are recognizing the fact that personalization is playing a key. As we move more towards preventive healthcare, personalization will be more. Excuse me. Sorry about that. So that's why I said right now
See,
it
but
seems.
there have been arguments that personalization will be the big pharma killer, right? I mean, there have been some thoughts coming about saying that future of healthcare is personalization, and personalization will what be killing the big pharma play because big pharma is a uh, uh, kind of pun intended, but it's the industrial house, right? It even controls government, so to speak, right? And the policies. So that is where a lot of people are actually seeing personalization of healthcare will be killing big pharma. But you're saying big pharma obviously are interested, but do you think how do you see them adopting this personalization? That is what at an industrial scale do you really see how does that work?
Which is why I said 10 years from now, you will not recognize it. It's the big pharma is going to reinvent itself. When I say reinvent, they're going to go into an acquisition spree to adopt a lot of what the startups have managed to change in the healthcare field. This will change. I mean the farmers have already realized it. And they're already figuring out ways to try and do it. And I think it all boils down to manufacturing and distribution. I think that's where, I mean, the the comfort in which any industry has got with manufacturing just one thing and manufacturing that to a large scale. I think that is going to get flipped a lot. It's going to be um, I mean, the good analogy I can give is you're going to get your you're probably going to get your Maruti Ciaz car. The only thing is the color, the doors, the interior system, all of that is going to be made out of your personal choice. The chassis is going to be the same, but the personal choice will differ. So that is the first level that we'll probably get into, and then from there we'll get into truly personalization.
Uh, so one is how the pharma industry will evolve. Perhaps you say the way they will acquire companies, and that's the obvious route because they're sitting with a lot of money. But how do you see the compliance changing to it? Because this is way different, right, from the way because all policies are made in a very generic sense. So
Um,
yeah,
uh, uh, that's the more difficult question to answer. So traditionally, compliance has always been the last to change. Um, 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 you
correct.
know,
Yeah, compliance always follows business,
yeah.
and only thereafter business follows compliance. But uh, how do you think, or okay, or do you think there are at least these are the fundamental things that the compliance will have to keep in mind? One, two, three, like you said, you've been in conversation with these pharma companies, right? They are also driven by compliance because they operate in that space. So, are there any thoughts going on in terms of any of these frameworks, conversations? Is there anything happening on that front?
Yeah, so compliance will always be on toxicity. That'll be number one. I mean, is there are you doing any damage? I mean, that's the first compliance. That compliance is not going to change too much. It's going to there'll be slight tweaks to it, but the measurement of is anything doing damage to you will still be there as a compliance and ensuring that something is not damaging to you. So you will still have requirements to show that your whatever you're giving as a therapeutic, even though as personalized as it can get, needs to pass that one level of the toxicity piece of it. Secondly, compliance is always um, hard about showcasing the efficacy. I mean, very very stringent in probably the Western markets, not so much in India, but there's always a compliance about saying that about words such as cure and reversal and those kind of things. So I still think those kind of compliance will still be in check. Where a lot of the compliance needs to change and needs to adopt to the future is probably again going back to the manufacturing segment. And um, because I think that is where a lot of the disruption is going to happen. We're already starting to see early trials of 3D printed organs. Um, so what is the compliance of that? What is the manufacturing compliance of that? I mean, all of those kind of changes will certainly take a little bit of research time and for that to evolve and come. I think that's where the most amount of challenge is going to be. But more than compliance, Nanjo, I think insurance is going to be. I can't fathom how insurance is going to change this way. The one change that I'm seeing in certain states in the U.S. where insurance companies are saying, telling the doctors the way we are measuring you is by patients not returning. The lesser the now number of times they're visiting your uh, hospital, the more successful you are. So the way of measuring what is good is changing that way, and it is not changing by some random blood measure saying that this person is healthy. So that is changing the incentives of how the doctors are treating and what they're looking as an outcome. So I think these are the kind of interesting ways I think the insurance will change in the future.
And what are the things that you worry about or work towards and trying to uh, navigate your company to the future in the way you think it's changing? What do you do on that front? Because apart from the product that has to be ready for the next quarter to from a product pipeline point of view, what you have, or even from a aspect of you mentioned that you continuously work towards keeping the price down and also expand the market and all that. But these are all very near term things. From a long term thing, what is it that you keep talking about?
Uh, I recognize that the market is going to change dynamically, and it's going to be there's going to be a lot of focus on the microbiome. So what we are very intentionally building out is capabilities around the microbiome that we can bring out any kind of solution depending on how the market is changing. So we don't.
So, what are
Uh,
those markers you think will indicate that market is changing or industry is changing? What markers you have marked as of now, at least from a point of observing, because it's very dynamic, but at least some starting point.
Uh, See, the one realization that we got about a couple of years ago is that we kind of looked at the data and came up with a key ingredient a key target that we thought would sell well to a pharma company. But interestingly, the the interest came from a nutraceutical company. I mean, one of the biggest chocolate manufacturers in the world. Saying that we rather use this as an ingredient in our food. And this is something that in that traditional mindset of thinking pharma, therapeutics, this is something that we didn't even think about. And that is what I meant by saying that we are building systems and processes and discovery pipelines in such a way that the end product could be used by any industry that is interested in it, and not necessarily just one particular small niche in an industry. So that is the mindset that I have for the long term.
Right. And uh, from a point of change that you want to bring about, right? What are the first three changes that you want to see happen that potentially, takes you to the future that you foresee?
Um, Changes in the market or in the business?
Any of those things. I mean, what are the things you want to see? I mean, you could say that I want the way the education is imparted at a higher education or academy. I want this to change in the way we already talked about. Insurance use anyway said will have to change. But in the way the financing happens or policy happens, or the data compliance challenges. So any of the areas, how do you see? Are there maybe challenges in even the supply chain? Uh, so where do you see? What are the three things that you have that those three things have to change in the near future that makes uh, business easier, good, and which also, I mean, your intention is that it will have a larger impact on the society as well, right? People are likely to be more healthy. So, what are those things that? What are the three things that you want to change? First, I mean, everything will change, but what are the things that you want to change first?
I have one. Bangalore's already become the dubbed as the Silicon Valley of this part of the world, and that's because of the truly the IT revolution that happened over here. Similarly, I can already see signs, but what I really want the change to happen is to see the life sciences ecosystem come out, emerge out really, of the world. Can we leapfrog Netherlands and Singapore and truly be that global leader in when it comes to life sciences and biotech. We have all the ingredients. We have the talent. We have the tech. We have all the ingredients in place. Um, as usual, I'll crib a little bit about government policies when it comes to this, but let's leave that aside. But I truly wish that I'm not saying Bangalore, but somewhere in India, we become that true life sciences hub, a biotech hub, where we're doing the
What does
next.
that mean? I mean, you say that a lot of things are already there, but we should be one. So, what does that mean when you say that we should be something like Singapore or Netherlands? You said, what is it that is required, lacking? Because that everything is already here. So, what is that
Uh,
one thing lacking?
I think finance is lacking. I think there's private
Finance
equity.
as in access to capital for startups, or the way the bank finances this, or what part of the finance?
Access to capital for startups is definitely lacking. I mean, life sciences, biotech kind of startups have not got that kind of an access because it's high risk, high gain kind of business. Gestation period is very very long. And these usually happens in the access to capital is easier in more mature markets of investing. So that access is definitely lacking, which is why you see a lot of the biotech startup move to either Singapore or Netherlands and try to make that business grow there because access to capital is definitely much better in those areas. Um, we in the earlier episodes we spoke about incubators. Now there are a few good incubators coming out, but that's not enough. I think there's a lot more incubators that need to come into the space. Like you rightly mentioned some time ago. I mean, in uh, for biotech, you need labs. Labs, the equipments are expensive. Can we can we use the equipment by the hour and pay rent by the hour? kind of incubators is what is needed. Um, and the general infrastructure around lab kind of infrastructures
Aren't they
that
coming up in academic institutions? Because government has
they are.
made a lot of grants available for academic institutions to set up their own lab.
Yeah, they are, but it's still few and far between. A lot more growth needs to happen. I mean, if we can set up more incubators, the faster the growth of these any of these ideas to product can happen. And lastly, I think we need to improve on the patent infrastructure as well. I think the government has done a lot of good things in that aspect, encouraging encouraging subsidizing patent filing and all of that. But um, the inventors need a lot more education on patents. We need that infrastructure built out really well. We need a good um, legal infrastructure that can help startups navigate through that the patent landmine. Um, a simple example: anybody wanting to do continuous glucose monitoring, you could. I mean, the patent landmine that Abbott has created is so difficult to navigate. You need to be a you need to good have to good have good expertise to get the tech across that. Um, so things like this will definitely improve the ecosystem. And once that ecosystem is improved, I mean, we won't look back. I mean, we'll be just driving the innovation in the space.
Right. So, Kumar, are you ready to make some predictions?
I'll try.
Please.
um, I mean, give me a direction. What kind of predictions do you want me to make?
Oh, uh, well, obviously, I think one you would want to look at in your own space, right? You see, this is what will happen. See, I think I look at predictions as markers. So I think it's okay to be, put our neck in the block to say that this is where it is headed. Because see, unless we start seeing little beyond the obvious, uh, we we won't know. So it is in that context, I say that see, if you can look at something beyond what is obviously visible and say this is what is likely to happen, which is okay. Which is see, in fact, if not for those science fiction books, a lot of scientific discoveries would not have happened. Is how I see, because we grow up reading those things and things start realizing and materializing. So from that point, so please look a little far ahead and see what do you see. And I mean, it's never about how much of it is right or how much of you
Yeah,
are wrong. It's not
sure.
about that.
Um, the medtech and biotech IPOs out of India is just going to go up by about 100x, I think. A lot of that is
By when do you see that?
that's the very difficult question to answer. But definitely within the next 5 to 10 years. I mean, the shorter range is 5 years, but maybe a little difficult. But closer towards 10 years, you will see a lot. There are so much of activity happening in the space, and so much of good
And one of them
innovation.
could be yours.
Definitely yes.
Yeah. Right. Okay.
Uh, but definitely yes. I mean,
Yeah.
little embarrassed to say it that way, but
I think we have
um,
to get out of this thing. Yeah.
so I think it's a sector that a lot of people don't um, notice that much, but I think there's a lot of innovative startups are going to become really big in the space coming from India. Um, we'd probably set the protocols for the way we're curing diseases coming out of India pretty soon. Um, uh, Let me try and simplify that. Um, the way I mean, it's curing a disease is not easy. I mean, it's especially complicated ones are very difficult. With just the sheer number of volumes of patients that the doctors see, that the pharma sees, that the scientists see, I think we are going to come up with very innovative ways of how we're going to combine AI, telemedicine, surgery, all of that, and with the access to so many patients over here, I think that's going to happen much faster here in India than anywhere else. My fingers crossed that people doing it, would do it in a proper manner. But I think you'll start seeing a lot of that happening out of India. Lastly, maybe you'd recognize this, Nanjunda, that Mysore is going to become a food hub pretty soon, food innovation hub pretty soon. CFTRI has been there as an age-old institution for the longest time, but I think the food innovation hub is going to become Mysore, and we're going to start seeing a lot of food innovations that's going to be happening out of India.
Well, interesting. I just triggered by your second comment that. So, do you see our lifespans going to be significantly increased? Uh, because
Um,
you're talking about curing is going to be so significant. So, how much of it is going to impact on our lifespan?
I would definitely say um, 125 will be would be an age where you'll see a lot more people living up to 125. Beyond that, I don't know. Beyond that, I don't think it's genetically possible right now. But I haven't.
What's your take on those people who are working on longevity and curing? They call it curing aging. In fact, I've been lucky enough to have had a couple of these people who are globally renowned in for their research in aging to have come as guests. So I urge the audience and listeners, if you're interested in that, please look them up. Dr. William and also Aubrey de Grey, some of the biggest names in the space. So, what is your take on that?
Definitely, healthy aging is something achievable, and we're probably a decade or two away from getting into healthy aging. So, what I mean by healthy aging is you probably will live up to 100 to 125 in a healthy manner. There won't be anything um, too drastically wrong, or all the old age problems that we see today might not be there as much soon. Um, I I
But you're
am.
still stopping yourself saying 120, so you don't really see that
Yeah, because from a
curing
genetic mix,
curing aging is what they say. Artist Dr. William he says
yeah,
that, and also I've also had opportunity to have some transhumanists in my in the future path. So please do look up and listen to them as well. So they say that living for 1,000 years.
yeah, solve a lot of the day to day. I mean, if you want to transplant your brain to a computer, that's a different thing. Then that could be an endless uh, life. But purely from a human body perspective, without getting too many of mechanical parts into the body, um, I there are certain aspects of the genetics which makes me believe that it's not possible beyond a certain age. I could be completely wrong. Maybe it is possible, but I think there are a couple of hurdles over there that we need to overcome. I don't know if it can be overcome because it's genetics, and we'll have to get into a lot of gene editing to get that right. But from a transhuman scenario, anything is possible. I mean, there's so much of intersection of life and technology uh, uh, in the maybe half a century from now, we won't be able to recognize which is technology, which is life.
Right. Well, uh, that's Kumar, and uh, I think the predictions are also very healthy for us to be. I mean, that's what all of us wish, right? Just be healthy till we're alive. So that's very very promising and positive note. And thank you so much for being part of this podcast. And I hope you all enjoyed it as much as I did in bringing it to you and share it. with those who appreciate it, and also subscribe to it for more. And Kumar, once again, thank you so much for being part of Future Fast and sharing your perspective on, apart from the business in the previous podcast, primarily on the future. And once again, thank you. Thank you, and wish you all the very best.
Thank you so much for your kind words, and thank you for inviting me to the podcast. It was wonderful interacting with you, and wishing you all the best for the Future Fast podcasts.
Thank you. Thank you once again.